of therapeutic communication. And so we want to make sure that we are responding to our clients' feelings and tone, that we're providing them with information that's evidence-based practice, that is up-to-date information. We don't want to provide them with our opinion. Nobody wants to hear, well, I think you have a 50% chance of living after this cancer diagnosis. No, people want to know, well, what does the research say? What does the science say? What is my possibility of living based off of the facts and based off of the evidence? We want to stay focused on our client, what's happening with them and their situation. Knowing it's okay to use silence and presence. A lot of times people think that silence is awkward. Well, silence doesn't have to be awkward. Silence is actually very therapeutic when it comes to nursing. Why? Because if a client has just been given a diagnosis that they weren't anticipating or expecting, such as a cancer diagnosis, or they have lost a baby, something along those lines, it's very difficult. Giving them a moment of silence, but still being present and there for them, tells them that you are there supporting them. And that is very powerful. We don't ask why questions, except for if, well, this is kind of a little controversial, but we don't typically ask why questions. If you are just meeting a client, you're just walking into their room, you're beginning to form that relationship with them, you want to refrain from asking why questions, especially on the NCLEX exam. You can eliminate those sorts of answers. But in the real world, once you have developed that trusting relationship with a client, say that you relationship with your client and you can ask them why questions, then that would be an appropriate time. Mr. Johnson, we've gotten to know each other over the last couple of weeks since you've been here on the unit. Can you tell me, why did you decide to do that? Why did you decide not to forego treatment? That would be acceptable. But if you're just walking into your client's room and you say, Mr. Johnson, why didn't you follow up with the doctor? You should have followed up with him 3 weeks ago. That is definitely something that we want to refrain from. So you can see the difference between the two. You've developed a trusting relationship with your client. It's appropriate. Just meeting your client for the first time, not appropriate. On the NCLEX exam, not appropriate. So refrain from asking those why questions. We also don't ask yes or no questions, except for in the case of possible self-harm. If your client is potentially suicidal, we do want to ask them, have you committed, or do you have a plan to commit suicide, yes or no? Because if so, we need to implement a safety plan. Safety will always be number one priority in those situations. Other than in that circumstance, though, we really should be asking open-ended questions. It allows for our clients to further communicate with us. It allows them to divulge information should they feel necessary. And again, it's just one step closer to forming that nurse-client relationship that's trusting. We don't want to explore, again, this goes back to the whole not asking why questions. We just don't want to come across as being judgmental when we're first meeting our clients and when we're beginning that relationship with them, especially on the NCLEX exam when you're talking about those sorts of questions. You want to refrain from answering questions that explore. And we don't want to say, don't worry, because we do not know what's going to happen in the future. And we don't want to provide our clients with a sense of false hope. All right, so like I said before, we utilize the 6 steps strategy for question success here at Avant to teach you how to answer these questions from a strategic point of view. And so this is it in a nutshell. Quick review before we dive into our first question of the day. Number 1, we want to determine the type of question. So we walked through this a couple slides ago. What is your focus? Meaning, what is it that the test question creator wants to know from you? And what are you dealing with? What type of question? Step 2 is you're identifying your topic. We identify the topic based off the instruction of the question, not based off of the story of the question. They could be 2 different things, so please do not be tricked by that. Step 3, we look for keywords and clues that are going to help us with our topic. These are often in the story of the question. Step 4, you're applying your knowledge. What do you know? You can't get around not knowing core nursing knowledge. You've got to know core nursing knowledge. What do you know about the topic? Is it expected? Is it unexpected? What should you do? What are your nursing implications? Step 5, we review and we eliminate. So we begin to look at our answer options and we're going to begin a process of elimination. Are there any that we can quickly eliminate? And then going from there, are there any strategies that we can implement? And number 6, rereading the question with the answer we've chosen to make sure that it makes sense. Are we actually answering the question that's being asked of us? All right, let's go ahead and get into question number 1 for the day. So, question number 1 says a client diagnosed with major depression has sleep and appetite disturbances and a flat affect and is withdrawn. The client has been taking fluoxamine 50 milligrams twice daily for 5 days. Which client behavior is most important to report to the next shift? Is it number 1? Client's flat affect? Is it number 2, a client interacting with a visitor? Is it number 3, a client sleeping from 2,300 hours to 600 hours? Or is it number 4, a client spending the entire evening in her room? All right, guys, so I'm going to do a minute and 30 seconds on the clock here. Please put your answer option into that chat box. I will be viewing it as they come through. So here we go. Alrighty, guys. So coming back together, I'm going to reveal the correct answer to you. And it is indeed number 3. Client sleeping from 2,300 hours to 600 hours is a behavior that is most important to report to the next shift. This indicates that improvement in the symptoms of depression is occurring as a result of a pharmacological therapy. The nurse would expect to observe improved sleep, appetite, and psychomotor behavior first before improvement in cognitive symptoms. This is a good thing. This means that the fluoxamine is indeed working. Number 1, 2, and 4, let's talk about why those would not be the correct answers. Client's flat affect. The client's affect is still a symptom of depression. Number 2, client interacting with a visitor. The fact that the client had a visitor is not as important as changes in the client's behavior. And number 4, client spending the entire evening in her room. Spending the evening in her room is a continuation of the client's withdrawn behavior and is important to report, but not as important as the improvement in sleep. So number 3 is indeed the correct answer. All righty. Question number 2. The nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Many family members are in the room around the clock performing unusual rituals and bringing ethnic foods. Which of the following actions should the nurse take? Number 1, if possible, Keep the other bed in the room unassigned to provide privacy and comfort to the family. Number two, restrict visiting hours and ask the family to limit visitors to two at a time. Number three, notify visitors with a sign on the door that the patient is limited to clear fluids only with no solid food allowed. Or number four, contact the physician to report the unusual rituals and activities. Alrighty, guys, here we go. Put your answer in the chat box. Alrighty, guys. So the correct answer to question number two here is indeed number one. If possible, keep the other bed in the room unassigned to provide privacy and comfort to the family. When a family member is dying, it is most helpful for nursing staff to provide a culturally sensitive environment to the degree possible within the hospital routine. In the Vietnamese culture, it is important that the dying be surrounded by loved ones and not left alone. Traditional rituals and foods are thought to ease the transition to the next life. When possible, allowing the family privacy for this traditional behavior is best for them and for the client. Number two, three, and four are incorrect because they create unnecessary conflict with the patient and family. All right, excellent job. Number one is the correct answer. Question number three. A client with a spinal cord injury who has been active in sports and outdoor activities shares his past activities. The client becomes emotional and asks the nurse, "Why am I unable to stop talking about these things? I know those days are long gone." Which response by the nurse conveys the best understanding of the client's behavior? Number one, be patient. It takes time to adjust to such a massive loss. Number two, talking about the past is a form of denial. We have to help you focus on today. Number three, reviewing your losses is a way to help you work through your grief and loss. Number four, it is a simple escape mechanism to go back and live in happier times. All right, guys. So, which response by the nurse conveys the best understanding of the client's behavior? So, 2 minutes on the clock here and go. Alrighty, guys, an excellent job. I think the majority of you guys did indeed get this one correct. Some people said that they were going back and forth between 1 and 3, but the correct answer is indeed number 3. Reviewing your losses is a way to help you work through your grief and loss. Spinal cord injury represents a physical loss. Grief is a normal response to this loss. Working through grief entails reviewing memories and eventually letting go of them. But let's talk about the others. Now, number 1, be patient. It takes time to adjust to such a massive loss. This process may take as long as 2 years or more. This response is not necessarily empathetic or responsive to the client's immediate needs. Number 2, talking about the past is a form of denial. We have to help you focus on today. This response does not allow time for the grief process, which is necessary for the client to work through and adjust to the loss. And number 4, it is a simple escape to go back and live again in happier times. The client is not escaping, but reminiscing what is lost to work through the grieving process. So number 3 is indeed the correct answer. All right, number 4, a new nurse is co-leading a family education group for those who have relatives with paranoid schizophrenia. Which statement by the nurse indicates the need for further teaching about management of this condition? Number 1, when the client gets overwhelmed, it is best if they spend some time in their room. Number 2, the more we push the clients to spend time with their friends, the more their voices decrease. Number 3, until we get the clients up and going, they seem to have no motivation to do anything. Or number 4, we still have to remind the clients that we do not hear the voices that they do. So, which statement by the nurse indicates the need for further teaching about the management of this condition? All right, guys, so 2 minutes on the clock. Here we go. Alrighty, now revealing the correct answer to number 4. It is indeed number 2. Guys, this is a negative query question, meaning we are looking for the incorrect statement. The more we push the clients to spend time with their friends, the more their voices decrease. Pushing a suspicious client into social situations is likely to increase anxiety, which increases, not decreases, their hallucinations. So this one would be an incorrect statement. Number 1, 3, and 4. When the client gets overwhelmed, it is best if they spend some time in their room. This indicates awareness and understanding of how to intervene when the client is exposed to stress. Number three, until we get the clients up and going, they seem to have no motivation to do anything. This indicates awareness and understanding of evolution. Number four, we still have to remind the clients that we do not hear the voices that they do. This indicates awareness and understanding of the client's hallucinations. So, again, be careful. We are looking for the incorrect statement. We're looking for the answer option that needs more teaching about management of this condition. This is a negative query question. So, making sure that you're working through your strategies, the 6 steps, is something that is going to help you in making sure that you are answering the questions correctly. Alrighty, let's do the last question in our standalones, and then we'll head into our case study for the day. A client has been experiencing intermittent vaginal bleeding for the past 3 to 4 months. The client is diagnosed with uterine fibroids, and an abdominal hysterectomy is recommended. When the client expresses fear about the surgery, the nurse should, number one, reassure the client of her physician's competence. Number two, give the client opportunities to express her fears. Number three, teach the client that fear impedes recovery. Or number four, change the topic of the conversation. When the client expresses her fear about surgery, which one should the nurse choose? 2 minutes on the clock. Here we go. Alrighty, guys. So coming back together, the correct answer here is number two, which most of you guys put. So excellent job. Number two, give the client opportunities to express her fears. The best approach is to allow the client opportunities to express her fears. Open-ended questions should elicit the client's individual and specific fears. This then gives the nurse the opportunity to provide clarification, information, and support, and to possibly offer other resources. 1, 3, and 4, these actions are not supported and deny the client opportunity to express her feelings. All right, excellent job, guys. You're doing awesome. Okay, let's get into our case scenario for the day. So the remaining questions that we work through today will be a part of the case scenario. For those of you who have just joined the program and this is your first time in Question Clinic, on the NCLEX exam, you will each work through 3 different case studies. Each case study contains 6 questions that build off of each other. You will not be allowed to go back in a case study and answer number 1 if you're on number 3 or 4. You must keep moving forward. So very important that you understand how to answer these case studies and work through them. My recommendation is that Nurse Achieve has about 145 case studies for you to practice. And so I highly recommend that you take advantage of all of those in Nurse Achieve and that you practice them and that you do them daily. All right, so the integration of the nursing process and clinical judgment. So the NCSBN, which I've mentioned a couple of times, is the governing body for the NCLEX exam. They created this clinical judgment model as a framework designed for testing. It does complement the nursing process, and we'll talk about how, but the question types in the NGN version of the NCLEX reflect real world nursing care, and they're going to use realistic scenarios or case studies like you would see in a typical nurse-client interaction, and focuses on the types of decisions nurses have to make in the clinical setting. So the nursing process, step one is to do an assessment. With clinical judgment, step one is recognizing clues. So we're saying in this first step, what matters most to my client? And don't forget, guys, assessment and recognizing clues is not just a head to toe. It's both subjective data, it's objective data. It is a head to toe assessment. It's looking at lab values, it's looking at imaging scans, it's reviewing the chart, and it's collaborating with other members of the healthcare team, including your client's family when applicable. So recognizing clues and doing an assessment is not limited to just a head to toe, listening to heart and lung sound. So keep that in mind. The next step of the nursing process, as we know, is the diagnosis. This is steps 2 and 3 of our clinical judgment model. This is where we're analyzing clues and we're saying, well, what does all of this mean? And prioritizing hypotheses. So, well, where do we start? The next step in the nursing process is to plan. This is step 4 of clinical judgment model, where we're generating solutions. And we're saying, well, what can I do? What's within my scope of practice? Next step in the nursing process is to implement this. This is where it's doing the action of. We're saying, well, what will I do? And the last step of the nursing process is to evaluate. This is step 6 of the clinical judgment model. This is where we're evaluating outcomes and saying, did it help? Is it making a difference for my client? Now, sometimes we don't always know if it helps because we don't always have the opportunity of seeing our client. Most of the time, we're going to discharge them to a long-term care facility. Maybe we're discharging them to rehab. Maybe we're downgrading them to a lower acuity level. So we don't always get to see the outcomes here. But nonetheless, we want to know if what we're doing for this client is making a difference. All right, let's read through our scenario together. So DC is going to be our client today. We are located in the emergency department, and the situation says DC is a 78-year-old female who was brought to the emergency department for evaluation. DC is accompanied by her daughter. The daughter states her mother has not been her usual self for the past 7 to 8 months, exhibiting less energy and interest in activities she used to enjoy, like family vacation planning. She goes on to explain her worry with her mother's decreased appetite. The patient's past medical history includes type 2 diabetes mellitus, hyperlipidemia, moderate osteoarthritis, and asthma. The patient's husband passed away unexpectedly 1 year ago due to a myocardial infarction. All right, so we have a mental status examination here. And it says the client has poor eye contact when communicating, slumped posture noted with negative affect, decreased psychomotor activity, and a slowed gait is noted. Speech is slow and low in volume. Appropriate rate and rhythm. Client states that she prefers to remain alone. Denies suicidal or homicidal ideation. No signs of delusions, paranoia, or overvalued ideas. The client is oriented to person, place, and time. The client's daughter states she is a voracious reader and continues to have good cognitive function. The client is able to recall short and long-term memories and states, I know that I have been off lately, but it's really hard for me to come out of this. Alrighty, so the mental status exam on the left-hand side is what we just read. Question 6 states, which of the following findings from the client's assessment require follow-up? Select all that apply. So thought content, appearance, insight, memory, speech, motor response, or affect. Select all that apply. So I'm going to give you 2 minutes. You can go ahead and just type in the chat for me. Which of these from the mental status exam require follow-up? Meaning, which of these are unexpected or not normal? So 2 minutes on the clock here, guys. Just go ahead and type them all into one message for me instead of putting each individual one into a message. So here we go. 2 minutes on the clock. All right, guys, coming back together, I'm revealing the ones that would need follow-up because we're looking at the ones that would be unexpected. All right, so appearance, the client exhibited poor eye contact and had a slumped posture. Speech, the client's speech was slow and low in volume. Motor response, the client had decreased psychomotor activity with a slowed gait. And affect, the client exhibited a negative affect. So these 4 are the ones that would require follow-up by the nurse. Question 7. All right, so the case study on the left-hand side remains the same. Question 7 says, select the corresponding signs and symptoms with the appropriate diagnosis. So I'm going to show each one of these and give you 30 seconds to put in the chat box for me which one you believe is correct. So we'll do this one by one. So with delirium, and you can just put a 1, a 2, or 3. So this is for delirium. Is this a chronic progressive cognitive decline, impaired short and long-term memory, changes in personality? Number 1. Number 2, acute onset of altered level of consciousness, disorganized thinking, and inattention. Number 2. Or is it number 3, an unwillingness to participate in activities, daytime napping, poor appetite, insomnia, or low energy? What is the definition of delirium? Is it 1, 2, or 3? 30 seconds. Alrighty, so I think almost every single one of you, with the exception of I think 1 or 2 of you, did indeed get this right. Delirium, acute onset of altered level of consciousness, disorganized thinking, and inattention. So, what is dementia? And these are the same. So, is it number 1, the chronic progressive cognitive decline? Number two, the acute onset of altered level of consciousness. Or number three, the unwillingness to participate in activities, daytime napping, poor appetite, insomnia, and low energy. So, what's the definition of dementia? Is it number one, number two, or number three? Alrighty. And it is indeed chronic progressive cognitive decline number one. Excellent. So that leaves us with our last one, depression. And since we already have said number two and number one, this leaves by default depression is number three, that unwillingness to participate in activities, daytime napping, poor appetite, insomnia, and low energy. All right, excellent job. Okay, so we have a geriatric depression scale here. This is just a short form version of it. It's 15 questions that you would typically ask the client. So you would ask, I'm not going to read all 15 of these to you, but you would read them aloud. And then you would check either a yes or a no based off of what the client has answered. So we're going to just move to question number 8 because it does show this again. Okay, so this is her geriatric depression scale short form, and it says, which of the following best describes the client condition? Number one, the client shows no signs of depression. Number two, the client is indicative of depression. Number three, the client is at risk for depression. Or number four, the client is suggestive of depression. So I'm going to give about 3 minutes if you choose to read through the geriatric depressed scale form, the short form. If you would like to read through that, you're more than welcome if it's going to help you to answer the question correctly. So I'm going to give 3 minutes on the clock for you to put the answer to question number 8 in the chat box. And then we're going to talk about the geriatric depression scale and what the screening tool means and how we are able to work through it. So here we go, guys. 3 minutes on the clock. Alrighty, so a lot of you guys are putting your answer into that chat box already for me. So let's go ahead and talk about it here. Well, first of all, the correct answer is Number two, the client is indicative of depression. So the Geriatric Depression Scale, also known as GDS, is a screening tool consisting of 15 questions which determine the severity of depression in older adults. Scores of 0 to 4 are normal, 5 to 9 are suggestive of depression, 10 or more are indicative of depression. And she's had 1, 2, 3, 4, 5, 6, 7, 7. Okay. So of the 15 items, 10 indicate the presence of depression when answered positively, while the other 5 are indicative of depression when answered negatively. Okay. 5 to 9 is suggestive of depression. So the answer to this should be number 4 then. 1, 2, 3, 4, 5, 6, 7. So it says 7 of them are yeses. According to the GDS depression scale, 5 to 9 is suggestive of depression. So the correct answer here should indeed be number 4. Okay. Number 4 should be the correct answer. This is a mistake that does need to be fixed. And again, you can look up the geriatric depression scale. You can just Google it or use another search engine to figure it out. But scores of 0 to 4 are normal. 5 to 9 are suggestive of depression. She has a 7, so that would be suggestive. Okie dokie. So the client has been referred to a clinical psychiatrist for further evaluation. Which of the following medications are likely to be considered for the care of this client? Select all that apply. All right, so we have some medications here, guys. So risperidone, rivastigmine, venlafaxine, sertraline, olanzapine, bupropion, amitriptyline, or diazepam. So 2 minutes on the clock, we're going to do a select all that apply. Which of the following medications are likely to be considered for the care of this client? 2 minutes on the clock, and you could just put a 1, 2, 3, 4, 5, 6, 7, 8, a 1 through 8 instead of having to type them all out. So here we go. Medication question. 2 minutes on the clock. Alrighty, guys. So I see answers coming in here slowly. This is a more difficult one. You need to, of course, know what each of these medications are and then if they are applicable to our client's situation. So this is more one of those trickier ones that I would say is in this case study. So let's talk about which ones are correct here. So venlafaxine, sertraline, and bupropion are the ones that would indeed be correct. So let's talk about venlafaxine for a minute. This is also like and sertraline, both of these medications are considered SSRIs, which are serotonin reuptake inhibitors, and are considered the first line therapy for the management of depression. So that is number 3 and number 4. And then bupropion is an atypical antidepressant that is used for management of depression. So if you said 3, 4, and 6, you would indeed be correct. But let's talk about the others because I see lots of you guys put other ones here in the chat box. So risperidone, this is an atypical antipsychotic and is used to treat delirium, not depression. Rivastigmine is a cholinesterase inhibitor used to treat dementia, not depression. Olanzapine is an atypical antipsychotic used to treat delirium. Amitriptyline is a tricyclic antidepressant. Although this class of medication is used for management of depression, it is not recommended for the elderly as they can cause harmful side effects such as confusion, constipation, and urinary incontinence. And donazepam is a cholinesterase inhibitor used to treat dementia. So knowing the difference between if these medications are used to treat delirium, dementia, or depression is important. All right, question 10. The daughter raises concerns about her mother's developing dementia, as there's a family history of dementia. Which of the following statements are appropriate for the nurse to make to maintain mental functioning for as long as possible? Mark the statements as appropriate or inappropriate. So we'll do this one by one. By maintaining a healthy lifestyle, there's no chance of developing dementia. Is this appropriate or inappropriate? You could just put an A or an I in the chat box, and I'm going to give you 30 seconds. All right, so that is indeed inappropriate. Watch for any more changes in appetite as maintaining a healthy diet is important. Is this appropriate or is this inappropriate? All right, so this is indeed appropriate. What about encourage your mother to continue reading and solving puzzles? Is this appropriate or inappropriate? All right, so this is indeed appropriate. This is a great activity. What about ensure your mother maintains appropriate glucose and lipid levels? Appropriate or inappropriate? All right, and that's appropriate. And last but not least, avoid your mother from engaging in weight bearing activities. Is this considered appropriate or inappropriate activity? All right, excellent. And this is indeed inappropriate. You guys did a great job with that. I think the majority of you guys were able to delineate whether this is appropriate or inappropriate for our client. So excellent job, guys. So that's all that we have for Question Clinic today. Thank you so much for coming. I hope that you learned at least one thing today. Like I always say, if you learn at least one thing, I consider that time worth spending. Okay. And if you have any questions, please don't hesitate to send me an email. mroden@avanthealthcare.com. If you missed any of these questions, you can view them on our other question clinics that occur this afternoon, as well as on Tuesday, Wednesday, and Thursday. So please don't hesitate to join those if you want to view the questions again. If you need more practice, you are more than welcome to come to those as well. I hope to see you next Monday, same place, same time. So thank you. Have a fantastic rest of your day. Bye-bye.